Hi, I'm Varshini Vijayaraghavan, and I'm a junior at Hamilton High School in Chandler, Arizona. And my project was about an approach on the efficacy of induced pluripotent stem cells in spinal cord injury repair and motor function recover. My research topic is I've already explained it, and I explored this issue because my long-term goal is to become a physician and focus on illness prevention, health promotion, and community and population well-being. And these therapies were critical for people involved in spinal accidents because people in car accidents are a big issue, and they're very major because it's occurring in Arizona a lot. And what is happening is that most of the spinal cord in all bodies are being damaged, and I want to make sure that the difficulty that people are enduring because of spinal injuries prompted me to pursue this idea. My objective is to focus on conducting the study to investigate the causes of spinal cord injury and the efficacy of induced pluripotent stem cells in spinal cord injury repair and motor function recover. And there's research questions I was thinking of while doing this project is, why do spinal cord injuries occur, and what are efficacy of stem cell therapy in improving functional recovery? This is important because there's high prevalence of life-altering consequences such as permanent disabilities like paralysis, and long-term healthcare costs are so costly, so it's a financial burden on families. And stem cell therapy can help with people and give them an opportunity to live better. Spinal cord injury is a serious medical condition where damage to the spinal cord in partial or complete loss of motor and sensory function below the level of injury, which causes paralysis and other complications. This paralysis can cause paralysis in arms or legs and every part of the body. Vertebrae compression is when it occurs for the spinal collapse or compressed. This condition often results from trauma such as fall or accident, or for conditions like SCI, which weakens the bones. So there's different types of therapy. There's supportive therapy, in which you can use physical therapy, where you use rehabilitation and tailored exercises. There's also electrical stimulation, where you have little electrical currents to stimulate movement and prevent muscle atrophy. And there's also um, massaging therapy, where it can help improve circulation. And then you have engaged therapy, where you can use stem cell therapy to promote neural regeneration and repair by transplanting stem cells. Stem cells that can be used are pluripotent stem cells, and they can be administered via direct induction into the spinal cord or systematic delivery methods. You can also use pharmacological treatments such as promote recovery and support spinal cord repair. These include drugs to target inflammation, neuroprotection, and cellular regeneration. My literature review was based on the efficacy of the PSCI, so I wanted to make sure it was safe enough to be using this drug. So the long-term safety of this iPSC is based on critical concern, particularly regarding tumorigenesis and immunogenicity, and it highlighted that these hold therapeutic promise, and their clinical application requires rigorous validation of safety protocols. There's also neural differentiation, in which it differentiates into various neural lineages, offering potential for target therapies in spinal cord injury. There's also functional recovery, which reveals that transplantation of iPSC-derived neurons leads to significant improvement in motor function. Methodology, as you all know, this isn't based on a lab. It's mostly because of research on multiple articles. So I initiated the study by using articles to find therapies for spinal cord injury, focusing on potential iPSCs for neural repair and motor function recovery. I collected data from journals like Google Scholar, Medline, and PubMed, evaluating iPSCs differentiation and integration into spinal tissue and their functional recovery outcomes. I then saw what is currently working in therapies and what therapies are in the process. And I realized that supportive treatments such as physical therapy weren't working, although it showed a slight recovery of the patients. But engaged treatments like the iPSCs demonstrated the ability to integrate injured spinal tissues and restore some degree of motor function. However, the critical issues such as immune rejection and risk of tumor formation remain significant and hurdles to solve before transitioning into human clinical applications. The conclusion is that the study highlights the potential of induced pluripotent stem cells in repairing spinal cord injuries and enhancing motor function recovery. We found that the iPSCs can integrate into host tissues and promote neural connectivity. There's multiple challenges though. So my future direction is to improve differentiation protocol for consistent outcome, and of course implement this in labs to be able to make sure that this is actually um, a good treatment for spinal cord injury. And you have to conduct long-term studies to ensure safety and stability of the direct neurons. And I want to share my research experiences. So Dr. Jobin Varki, thank you so much for this opportunity. You've worked so hard in helping me understand the science behind my study for 8 weeks. You taught me background for neuroscience and in-depth topics to help me with my research. And thank you to Professor Virgil because you helped me so much in creating an ethical scientific paper with multiple one-on-one sessions and helped give us the credit to ourselves. You wanted us to become successful in creating our first paper or the best paper in all of the papers we have written previously. And this research program created by Coach Joe, thank you so much for this opportunity because I don't know if I would be interested in this topic if it wasn't for you. And I've been enhanced in my understanding of neural mechanisms and owned my research skills in analyzing scientific literature. And the most thrilling aspect was creating a paper with real-world neuroscience issues. And my completed part was most thrilling part of my journey in the research. Thank you.
Wonderful presentation. Thank you for the kind words. Dr. Jobin?
Very good presentation, Varshini. Very detailed presentation. And I hope that you're continuing to look more into detail of this particular, what you call treatment of spinal injury and all, how it is done. So a question with respect to iPSCs or stem cells, what exactly are induced pluripotent stem cells? Could you tell everyone? Could you please tell everyone what exactly is induced pluripotent stem cells?
Yeah, pluripotent stem cells are used as treatment for a spinal cord injury, and they have a potential to differentiate in almost any cell in the body. So we inject this directly in the spinal cord to be able to produce more motor function. And as provided in my slide, they help with early stage embryos in generating promise that it has personalized medicine and regenerative therapies and can be used to test new drugs in order to prevent spinal cord injury and prevent paralysis in the future.
So can you tell everyone like why it is called as induced? What is the difference between stem cells and induced pluripotent stem cells?
I think induced means like it can be generated from like adult cells when they're like already formed, and that they have the potential to differentiate in almost all the cells, so it's easy to use those type of cells.
Yes, very good, Varshini. So yeah, that's exactly the answer. And then you can also probably when you present it somewhere else, you can also add that particular thing into your slide where you mentioned that the stems or the cells which are like adult cells where you like fibroblasts or whatever it may be, or blood cells, they can be transformed to the stem cells or pluripotent stem cells using certain factors, protein factors or genes, which are involved in this transformation of the cells, blood cells or fibroblasts into the pluripotent stem cell. Because since your whole topic is on induced pluripotent stem cells. Good job, and continue to work on it. And I hope that you'll do well in future.
Thank you, Dr. Barkey. And also thank you, Dr. Coach Cho.
Yeah. Take care now. Wonderful.